Guru Nation, how is it going? I'm here with Caitlin Welch. We just randomized the patient today.
Yep.
It always feels good to do that. We think we did everything right. 99% sure we did. There's always that unknown, no matter how experienced you are. And you did the whole thing on your own.
Yeah.
I mean,
Besides blood work.
yeah,
But
the blood, well, even that, you had it set up, you processed it. So, what advice can you give other coordinators on making sure randomization visit goes well? We talked about a few things like making sure that the lab results are there, making sure that the EKGs from the screening visits are there, and then going through all the IE criteria. But what advice, now having gone through it for the first time on your own, right?
yeah.
What advice?
I would just make sure you have all the lab reports back from screening. Make sure they do. Well, we had e-diaries that they had to do. You needed at least like 11 days worth. So for me, I just had to double check and make sure they did 11 days worth, because they may skip a few days or so. But for this patient, we screened her right after the 11 days because she kept up with it. Other than that,
She returned her IP that we dispense at screening. Not all studies get that at screening, but she returned it. Did you have to do IP accountability on that one?
yeah, you always have to do IP accountability.
Oh, okay. So you're doing that. You're gonna do that soon.
It's just a log that I have to do,
Okay.
and online as well.
And then the PI, we got a chance to make sure the PI came in and documented his progress notes as well. Labs are gonna go out later today, so pretty smooth for your. Was this your first one on your own, or you did another one already?
No, my first. Well, not my first visit on my own, but my first randomization on my own. Yeah.
First randomization, and you would have like been completely on your own, but I forgot Sunday that I have the cash to pay the patient, so
Yeah.
I was like, no, I'll just do my podcast in the office. So it was kind of cool. I did a podcast while Katie was randomizing someone. All right. Any other advice for coordinator? Randomization, not hard?
Not hard. It's pretty much, well, our visit is just like screening visit, so without a few things. So it went by quick. It's pretty much the same visit over again. Just make sure you don't switch up the IPs when they hand you back and then you give them the new one.
Yeah, okay. And then you also did accountability for their rescue meds too. Okay, so there's a lot of like study specific stuff. And then when do you enter data in the EDC system? Do you usually do it the next day or like the same day?
Usually you want to try to do it same day, so you don't forget about it. But sometimes when we get super busy, you do have to do it the next day. But everything you do is online first. So everything gets done online first, and then you go back, and we have binders. So we go back and do the paper binder logs and stuff.
All right. Thank you, Katie. Everybody like, subscribe, comment, share. Catch y'all later. Bye-bye.